What if I told you that chronic venous insufficiency is not as big of a problem as it might seem? So in recent news, you may have heard about our President Trump, who has had some issues with supposedly this condition, chronic venous insufficiency. So there are about three main important vascular issues that people are going to deal with. So chronic venous insufficiency is one of them. Peripheral vascular disease is another term that we use to describe more the lack of blood flow to the vessels, either due to nerve damage from diabetes or due to the same plaque that builds up in the heart, that can build up in the arteries of the leg. And the third one is much more rare and is more like an autoimmune type disease of the vessels of the legs. So let's focus on the first two because those are the most common by far. Chronic venous insufficiency can happen when the veins in the legs don't function the way they should. Sometimes the valves were just born genetically with a little bit weaker valves, and we might even see varicose veins on the surface. And these veins over time can become a little bit larger. And because that blood stays stagnant and pools in the leg and can't get pushed up into the rest of the circulation, it will ooze out a little bit of fluid. So the legs can seem a little bit dilated, a little bit edematous or heavy. They're retaining water. There are a lot of good treatments for this. We can do laser therapy for the veins. We can strip the veins out. And of course, just wearing some compression stockings, which is the most easy treatment, can help resolve 80 to 90% of cases. The last one, the second one, is the actual circulation problem due to plaque buildup. This is much more severe and is one of the complications of elevated blood pressure and high cholesterol and sometimes elevated blood sugar. This can cause damage to the nerves, or it can deposit plaque inside the arteries, preventing proper circulation, and that can cause very similar issues from skin breaking down to swelling in the legs. And so, of course, with all of these conditions, prevention is always best. That's what we talk about here in my Healthy Aging channel. If you want to work with me directly, I would love to be your health coach. I have some information in the description below. Take care.